Have you ever twisted your ankle and wondered if it would feel normal again? Today, we're uncovering the real secrets behind sprained ankles and what most people, even doctors, get wrong about them.
Good afternoon. This is Dr. Mitch, and we're going to talk about ankle sprains today. Inversion ankle sprains, or rolling of the ankle inward, is probably one of the most common injuries that most of us suffer for one time or another in our lifetime. I talk to a lot of people and a lot of patients, and most of them have sprained an ankle or two in their lifetime, usually in athletics, or sometimes just walking down the street and hitting a rock and twisting the foot in the wrong direction. That's all it takes, or stepping off the curb, or stepping on a toy that your pet left in the middle of the room and you didn't see it, and you hit it with your foot. And the sprain occurs when one foot is planted on the ground, when the other foot is in the air. That's called the swing phase of gait. And the planted foot rolls inward from stepping on the object or stepping off of the curb, or an abrupt upper body movement, which causes a sudden weight shift to the outside, which rolls your ankle inward. And this inward roll causes a number of things to happen. The anterior part of the ankle ligament tear. There's three ligaments: the one in the front, one in the middle, and a little one in the back. And the one in the front usually is the first to go, and the fibers tear a little bit, and the ankle becomes mildly displaced in its joint configuration. And the cuboid bone, which is a small bone on the outer side of the foot, just in front of the heel bone, it will rotate and become displaced, and that'll cause all kinds of problems in the healing process. Most people don't, a lot of doctors don't know about this. The rolling motion, if it goes further and further, the middle ankle ligament will tear, and there's more bone and joint displacement. And the peroneal muscles, the muscles on the outer side of the leg, go into a mild little spasm to protect and guard against further injury. And then last but not least, sometimes the joint capsule and the other soft tissues around the ankle are torn or damaged in the process. The diagram outlines those structures for you, and as well as the cuboid bone. Actually, there's a lifetime guarantee that comes with ankle sprains. There's there These are some of the conditions that come with a guarantee. Number one is scar tissue. Any injury is going to heal with scar tissue. It interrupts the meridian duct flow and the direct current system, especially the bladder and gallbladder meridians, which are in the lateral part of the foot and ankle. There's some degree of loss of motion because of the scar tissue. There's an emotional memory to the injury at the time of the injury, which somehow or another remains in the tissues forever and ever and ever. And there's some things to do to prevent delayed healing. A lot of ankle sprains are healed in 4 to 6 weeks, and a lot of them are almost healed in 4 to 6 weeks, but 4 or 6 months later, they're still having problems. And there's reasons for that. The cuboid bone being displaced is one. Continued irritation to the peroneus longus muscle tendon under the cuboid and around the outer side of the ankle. Of the soft tissue is scarred around the ligament, the retinaculum, the soft tissue that's holding the tendon in place. If that's irritating the tendon, the muscle will be in mild spasm and it will alter the gait pattern and the gait cycle of the foot and the leg and the knee, and it eventually affects the hip. There are things to do. We can tape the foot and ankle to get a little support at the same time, allow for some mobility and some motion. Normal motion is good to have after injuries because the body part will get accustomed to splinting and guarding and the protective mechanism of not moving, and it'll get stuck there. So it's important to keep it mobile, keep it moving, at the same time keeping it immobile. That's a paradox to, keep it immobile, but let it be mobile. But yeah, it needs a little bit of movement. And one of the major things I do now, is a Bowen Therapy session as soon as possible after the ankle injury. The day of the injury or the night of the injury, the day after the injury, the sooner the better. And it includes the ankle procedure, which it releases the tightening and the tension in the soft tissues that are holding the ankle a little bit out of place because it's put out of place with the injury, the force of the injury, then it has held there by the soft tissue structures. And the holding pattern in an abnormal position isn't good. And so the sooner that you can get to the ankle, and it's a fairly painless, if not a completely painless little procedure to give the ligaments a little bit of a rub and a little bit of stimulus, and then take the foot and just tap it, and that resets the ankle back in place. And it's amazing what it does. And I'll tell you a little story about that in just a minute. And then we manipulate the ankle and the cuboid joints to reestablish joint function, eliminate the joint dysfunction. And those are the things that I do short term to enhance healing. And and then on the long term, once the ligaments and the soft tissue is healed, it's a good idea to have a McLoughlin Scar Release technique, MSTR, performed on the lateral ankle area where the ligaments had been ruptured and are now scarred, because the McLoughlin technique will soften and reduce the scar tissue. It visibly reduces scars that you can see on the skin surface. It also reduces the scar tissue down deep. And so, in doing this little 5-minute maneuver around the ankle, it'll free up the ankle so that it has more mobility, and the upper body won't be compensating for the fact that the foot and the ankle aren't moving properly. There was a study done by Janet Traval. She cited the study in her book, the Trigger Manuals, and she didn't tell where the study was done, but they stabilized the feet somehow or another, and they found that they had an instantaneous effect on the incisal opening of the jaw, that the people that got their feet stabilized or some method or another, their jaw opened wider. There's a connection between the feet and the ankles and the jaw. There's this connection between the knee and the shoulder. There's a connection between the cervical spine and the lumbar spine. A lot of body parts, when one body part moves, some other body part moves at the same time because of the tandem effect, and to maintain symmetry and balance. And it's all about keeping the eyes level on the horizons. And so if your one leg is doing something, the other leg will do something else to compensate, to keep your eyes level, I guess, your jaw straight. And yeah, so that helps a whole lot to get the feet stable. And the first time I did a Bowen session on a young lady, so I was at a seminar on Friday and Saturday, and one of my classmates was there from my initial Bowen class. And it turns out he was working with his brother, who was a trainer for the University of California, Berkeley football team. And so he invited Craig, his brother, to come sit on the sidelines and do a little therapy for the football players who were injured during the games and or after the games. And so Craig was on the sidelines and he started treating, number one, he started treating concussions. And he has a paper that he wrote, and I get it referenced in the down, information down below, but you can look it up. He's had wonderful results with concussion, post-concussion syndrome. And but he also worked on ankle sprains. And I said, when do you work on the ankle sprain? And he said, well, as soon as I can get to them. So, I said, on the sidelines, on the field. Yeah, yeah. He says, right, on the bench. And I said, oh, really? Even though it's swollen and painful? And he said, yeah. He says, the sooner you treat them, the better. And so, as fate would have it, the first patient on Monday morning in my office was a young lady, 12 years old, who sprained her ankle on Saturday playing soccer. And she had one of those overbearing fathers who was ill, paranoid. She's not going to be able to play in the tournament the following weekend because, and then she is on the select team and the select pair. That she's an all-star and all that. And so I said, well, okay, well, what were you? She'd been to the emergency room, had X-rays, and she had a posterior splint, and she was on crutches. And I said, well, I've got this procedure. I'm going to release the soft tissue on her leg, and I'm going to give you a little mild little thump to the foot to reset the ankle, and we'll see how that does. And so I faked it a little bit, I pretended I knew what I was doing. And I get with through the leg muscles and the procedure to on that part of it. And it was time to do the foot. So I manipulated the ligaments just a little bit. Then I circled the foot and I said, okay, here goes. And I hit the foot and she didn't flinch. She didn't move. And I said, okay. And so I said, we're done for today. We'll keep using the splint off and on if you need it. And so she jumped off the treatment table and she said, grabbed the crutches. She said, here, Dad, you get the crutches. And she walked out the door. And she's like, nothing to do with son. She like had a normal ankle. And so that set me on the road to treating ankles a little bit differently than I had been trained to in the years past, and with this, what was the standard of care? Because the standard of care was to immobilize it and keep it protective and keeping non-weight bearing for 2 or 3 weeks, and then guarded weight bearing with cam walkers and cast boots and adhesive tape strappings and all of that. Not necessary. Just do the Bowen session, and once in a while I will put some tape, adhesive tape strapping around the ankle to give it a little bit of support, and then wait for it to heal. And it's usually is over with in a matter of days. And so, but it's important if after 6 or 8 weeks to get in there and soften the scar tissue that forms around the ligaments to prevent stiffening and tightening of the ankle mortise and the foot, so the normal range of motion can occur. So thanks for letting us listen to the video today, and please hit the thumbs up and like the video, and we appreciate it if you subscribe to my channel and look down in the comments box and you can see a couple of references and links to other material. So thanks for having me and have a good day.